I wanted to talk about was different types of therapy for different types of trauma and why some types of therapy may not work as well as others. So for those of you who have experienced CBT or cognitive behavioral therapy to deal with your trauma and have not experienced or not had really good results with that, there's a brain reason for that. And so I thought I'd put your mind at ease, put your brain at ease, and explain the reasonings behind that. When you look at anxiety in your brain and what goes on in the brain chemically, yes, the portion of the brain that is responsible for processing the fear or anxiety, that is that amygdala, the fight, flight, fear, conserve, withdraw portion of the brain. Okay? Fight, freeze, conserve, withdraw. Make sure I get them all. That section of the brain is responsible for processing or for activating one type of anxiety. But technically, there is another portion of the brain that's responsible for igniting or starting another type of anxiety. While it's all processed emotionally in the amygdala, the other type of anxiety comes from your thought process. Okay, so more generalized anxiety comes from here, your thinking, right? This is when you are anxious over what if I can't pay the bills at the end of the month? What if my spouse or my child or I get into a car accident on the way to work, what's going to happen? Or those types of maybe OCD issues, generalized anxiety disorders, that stems from this thinking portion of the brain. Now, it's processed as you're thinking this. It then affects the chemistry in your brain and affects and activates the amygdala. So the amygdala is still processing it, but it comes from, or it starts from here, your thinking. Now, the other type of anxiety or the other source of anxiety is the direct information that goes to the amygdala before it hits your thought process. And this is what you find oftentimes happening in PTSD and C-PTSD, right? Because you hit triggers, right? There's a sight, a sound, a smell, a feeling that pops into your body or that pops into your environment that instantly, because the amygdala works, the emotion portion of the brain works 80,000 times faster than the thinking portion of your brain. Okay, so it happens instantly and you don't really even know what's happening. And this is very common in chronic PTSD or post-traumatic stress disorder as a whole. Right? It happens instantly. It's not processed through the thinking portion of the brain. It's processed in the amygdala before that sight, sound, feeling, sense, smell, whatever hits the thinking portion of your brain, because it routes quicker through the thalamus. It routes quicker to the amygdala and it triggers that emotional response or that stress response, that anxiety response. Now, here's the kicker, and this is what I want you to understand. That the thought process, if the anxiety is coming from here, like I said, generalized anxiety disorders, OCDs, those types of things, if it's coming from here, then your cognitive behavioral therapy or going through those workbooks where you're answering those questions, is this real? Or even what I teach when I teach controlling your rants, your regularly occurring negative thoughts, right? Controlling those. That's more your talk therapy. That's more your cognitive thinking therapy, where you're able to cognitively work through or think through what's reality, what's not, what's the true potential outcome versus what's the imagined potential outcome, right? Now, for those of you suffering with PTSD or C-PTSD, that therapy is not always going to work functionally for you. You may have tried it and you may be disappointed in the results. And it's because of the fact that it's triggered by the amygdala first, not by the thinking portion of the brain first. So the treatment for that is very different. That's why I've mentioned on past videos, if you are in this category, you might really want to, and please, always check with your therapist first. Always check with your doctor first, right? This is an informational channel. I'm giving you the information. Check with your professional first, right? If this is the way you feel, if this is what you suffer from, then you need more of the physical therapies. This is where EDMR comes in. This is where mindfulness training comes in. This is where neurofeedback comes in, right? These are therapies that work more on that lower section of the brain, that emotion portion of the brain, than your thought process, right? And you may need a combination of both, just depending on your individual situation. So I thought I'd shoot this video. I know it was a little bit long, but hopefully that makes sense. Two different sections of the brain that really stimulate anxiety. It is either here in your thinking cortex, then processed by the amygdala and the hypothalamus and all the rest, or it starts directly in the amygdala and is triggered directly in the amygdala instantly, in literally like a tenth of a second, like it's a split second that is triggered. So before you're even able to engage your thought process, it's triggered directly in the amygdala. Oftentimes what you see in post-traumatic stress disorder. All right, hopefully this has been helpful.